everybody, it's Freeman-Similien, SRN, and I just wanted to make a really short video about some politics in nursing. Over the weekend, I worked 24 hours. I did two 7 to 7, 7 a.m. to 7 p.m. And I'm usually prepared for aggressive behavior from some of the nurses. Maybe they don't want to talk, or maybe they just that type of person that they don't really want to communicate with the people they work with, or they have that matter of fact personality. So I'm used to that, but I actually ran into some passive aggression this weekend, and I was not ready for it. So I just wanted to just let people know to be ready for these type of behaviors, because these behaviors can be more volatile than actual aggressive behavior. Real quick story. I was in the pantry preparing coffee or a drink for one of the patients who had requested it. And one of the nurses, one that decided to not give me a report and also did not talk to me the whole entire shift. So I seen her struggling with her patients because she wouldn't ask me for help. And I just felt like, I'm not going to just step in. I do a lot of just stepping in and working really hard. However, I feel like if you don't acknowledge me, I am not going to just step in. So I didn't. So I think she was getting frustrated. It was about 5 o'clock at the end of our shift. And she came so close to me to grab a cup, but did not say excuse me. It was like as if she expected me to move. And see, that type of passive aggression behavior is something that I'm not really used to. I just feel like everyone is a person and you have to have respect. You can't just come this close to someone, you know, in that manner and not say excuse me. That's very rude, and I really didn't appreciate it, and I was really ticked off after it happened. So I just wanted to let everybody know that these behaviors are also behaviors that you have to watch out for. Just because a nurse isn't speaking to you doesn't mean that she or he won't push their power around, and so to speak. As for me, I will be a nurse in 3 months, so I'm in a different state in my education where I can let things like this slide off. But after thinking about it, I will not let another person come that close to me, and I will nicely say, hey, can you please say excuse me? It's just common courtesy. Everybody's a person, no matter what level of the food chain they're in the hospital. And I just wanted to make this video to let you guys to be aware of behaviors like this, because it is not right. And even though it's not outrightly aggressive, it is behaviors that make the workplace difficult to work under and make you feel like there's pressure, especially when you're still learning. So I hope everyone have a good day, and I hope that this enlightens you in some way. Again, I'm Freeman-Similien, SRN, and I will be back next week with another video.